All right, good evening, everyone. My name is Erin Hennessy, and I'm a nurse practitioner at Blush Aesthetics. Today, we're going to be talking about our wellness program. And so we're really excited to have all of you here for this webinar because I think it's important to start talking about some of the other topics that play into how we look, how we feel, how we function through the day. Aging is inevitable. The alternative is not great. So we want to do that. We want to age well. We want to make sure that we're feeling good, we're looking good, our confidence is good, and our energy levels are where they should be. So we're going to talk a little bit about that tonight. We're going to talk about bioidentical hormones. We're going to be talking about replacement therapy or optimization therapy, as we call it. We're going to be talking about Diva, which is a vaginal rejuvenation laser that has a couple different uses that folks might not know about. We're going to talk about lichen sclerosis, which is a skin condition that both men and women can actually suffer from, really, that we have options for management that have been very successful. And we're also going to talk about medical weight loss. So I am going to go ahead and hand off to Dr. Scott Burnham first for hormones. But first, let's do an overview. Next slide, please. All right, so like we said, aging is inevitable. There's no magic wand. There's no magic pill. There's no magic one treatment that will fix everything. And so aging is also multifactorial. There are times in our life where we have more stress than others. There are times in our life that our sleep is better than others. We have so many things going on typically at one time that there's really not one thing that we can say, oh, let's go ahead and fix that and everything else will be fixed too. So the state of health is that normalcy of that human body to function as it should. For us to do all the things that we should be doing as far as nutrition, as far as hydration, as far as sleep. And so, as we're looking at some of these deviations from health, we're also looking at how to normalize that. So common does not always mean the norm, even though so many of us are saying, oh gosh, my energy levels are low and I'm too tired to exercise. I'm not getting enough exercise, or I don't have enough time to cook good meals. And, I feel like my nutrition is suffering from that. So just because these are common themes doesn't mean it's necessarily the norm. And we really do want to have that good foundation where most of us are aging, I would say, in the demographic that is also looking for aesthetic services, but we're also looking for healthcare services that meet us where we are, and that's in more of a preventative state. So we want to have energy. We want to feel good. We want to look good. And medicine is really at a crossroads of that. So we're finding out the why. We want to help the root cause. We don't just want to kind of go on and say, oh, let's put a Band-Aid solution on this. Let's put a Band-Aid solution on that, because that's not going to help. But we really need to get down to the root cause of why are we feeling this way? Why are we having these issues? Why do I not feel great when I wake up in the morning or feel well rested? Why don't I have energy to get me through the day? Why don't I have energy to work out and exercise and do different things like that? Why do I start seeing my skin dry out, become dehydrated, not look as luminous as it did before? So we really want to get into the whys. All right, I am going to give this over to Dr. Scott Burnham, who will introduce himself and tell you a little bit about his background and about his training. Dr. Burnham, take it away. Looks like we might be having a little bit of a technical challenge.
Dr. Scott, you are muted.
Got it. I'm okay now. All right. Thanks, Erin, for having me. Thanks, you guys, for being patient. My name is Scott Burnham. I am an emergency physician. I grew up in Arizona and did my medical training at the Western University of Health Science in California. I then was selected for the residency at Toledo Hospital, or I'm sorry, St. V's Hospital, and then took a job at Toledo Hospital after that, and I've been in the area ever since. What we'd like to do, Emma, you can go to the next slide, is we'd like to get to understand a little bit about hormone replacement therapy and why it's needed. So the first question here is who it is for. Well, unfortunately and fortunately, it is for everyone, both males and females. Even the fairly young to the fairly old, we can still make differences. And what we're going to do is we are going to balance your hormones. We're going to find out and regulate the hormones that should be there in a natural state. You can go on to the next slide, Emma. All right. As a patient, our primary goal will be to balance your hormones. There are multiple hormones that we require to have in our system at all times and that are actually balanced to function at top level. So our primary goal is to balance these. This is a challenge and not just a one shot fits all, because it is a personal need that we have to find out where your levels are starting and how we can change it. Now, each of your hormones interact with your body, other hormones, and various phases of your life, including stress. So it is very personal that we need to look at the reasons that could be causing the hormones to be balanced. Metabolism of our hormones is also one of the functions where we tend to lose and get the hormones that are off balance. So what do we want to do? We want to relieve symptoms. We want to help everybody feel better. These are some of the symptoms that we know we can manage with hormone replacement. Hormone replacement is also going to be beneficial. If you could just go back real quick, it's going to be beneficial to the heart. This is going to be cardioprotective. It's going to help our bone structure and our bones growth and production stay intact. This is also going to prevent memory loss, which is a key component for all of us as we age. Okay, next slide. Here are some of the causes of your hormones being out of balance, out of whack. Of course, number one is age. As we age, we will start to lose production. Stress can cause all sorts of problems and imbalances with our sugars, infections, and even our well-being physically. The hormones can cause weight gain. We want to make sure that we address that as well, because some of the hormones are produced in your adipose tissue, which means the more will be produced if you are obese or overweight. And that can be brought back down to normal. Your diet is very important and how this all relates. Okay, next one. Here is just an idea of how fast your hormones will drop when you age. The first one to start to be noticeable is your progesterone. And at age 35, approximately 50% of women will have low progesterone. And this will drop to about 75%. So this is a very important one that we need to pay attention to. Estrogen. Estrogen is a main hormone that we need to pay attention to. This one will start to become low at age 40. This depends on the female, her history, and how some of those other stresses in her life are affecting her. Testosterone, both for men and women, will start to drop at an early age. So we want to make sure that that is also a balanced hormone. Okay, next slide. Just want to try and explain how important some of these hormones are. So we're going to go over estrogen. Estrogen is broken down into 3 types of estrogen. The first one is estrone. Now this one is produced very predominantly after a postmenopausal, starts to get higher levels postmenopausal. The problem that we have with this is high levels of estrone provides an increased risk to breast cancer. We want to be able to get that as low as we can. Second one, estradiol. This is one of the main estrogens people are familiar with. And in our body, it will help with bone structure. It helps with memory. It helps with HDL. It'll drop your total cholesterol, your triglycerides, which then decreases atherosclerosis of your heart and vessels. So this is cardioprotective. It's also an antioxidant. All right. E2 is 12 times as powerful as E1. Now we get to E3, which is 80 times weaker than E2. So even though it's a lot weaker, it does provide a high level of protection against breast cancer. What we found is that E3 will go in and block E1 in the breast cell receptors. This is also important in maintaining pregnancy in the younger females. Okay, next slide. Speaking of the receptors, there's two receptors in our body that estrogen circulates and binds to. That is alpha and beta. Alpha is one that causes cell proliferation, cells that start to become active, divide, replicate. Beta is the one that we want to bind to. This is a beneficial receptor. Now, our E2 will bind to both equally, whereas E1 will select the alpha, the one that causes cell proliferation, at a rate of 5-to-1. The E3 will help block the E1 receptor in the alpha cells, in the alpha receptors. So this is where we can find a way to decrease the risk of breast cancer in females. Okay. Now, we are going to be trying to match your hormones with the levels that they need to be. And our plan would be to use transdermal for estrogen. We never want to use oral because that will cause a high risk of breast cancer. We'll be using gels and creams to help with that. Oral progesterone seems to be very effective. Okay, next one. Why do we want to use these type of hormones and not the ones that are produced in a lab? Well, because these are not the same. Progestin is one that is very common and heard of. When people take these, they are on average only 30% similar to the hormones your body makes. It will mimic some of the activity, bind to some of the cells, but it also binds to other cells that it wasn't intended to. It will also not bind to cells that it is intended to. Next cell. And then there are risks with it. As you can see at the bottom, the main risk is for breast cancer. It can also bring up the risk for heart disease and strokes. So bioidentical is what we are going to be talking about. This is the hormones that are made by a plant derivative, and they mimic our natural hormones that are in our body and not the synthetics. Next one. So again, we talked about hormones being off balance. And these are the symptoms that it can cause. Estrogen has been found to produce 400 functions in our body. So it has a wide range of activity that it does. Again, one of the most important ones that I think we need to focus on is our brain. This will help prevent brain memory loss. The reasons why is because estrogen increases blood flow to the brain. It decreases distractibility. It increases acetylcholine. It actually also increases NMDA, which is now being found to be a component of Alzheimer's. So by improving this with estrogen, the risk of memory loss or Alzheimer's going down. The next would be our heart. This decreases coronary calcium. Estrogen decreases hypertension and congestive heart failure symptoms. Our bone mass. Our big concern when the elderly fall in the emergency room is that they could break a hip. Estrogen loss contributes to bone decreased density. We want to keep the bone mass high. Maintaining your estrogen levels will increase your bone density. Okay, next. Testing that is done in the office and labs includes saliva, serum, dried blood, and even dried urine. These are fairly inexpensive and are convenient for the patient, and we would be able to establish the best testing methods for each client. And that's what we have on hormone replacement. I'd like to thank you for your time. And if there's any questions, please ask.
Thank you so much, Dr. Burnham. Yes, our chat box is open. And so if there are any questions that you have, please go ahead and put them right there in that chat box, and we're happy to get right back with you. So our next presenter is Charlotte, who is a nurse practitioner at Blush Aesthetics, and she is going to be talking about Diva. Charlotte, take it away.
Thank you, Erin, and thank you, Dr. Burnham, for your presentation on hormones. It was extremely informative. I'm going to talk to you all tonight about Diva. It is probably one of my favorite things to talk about, and I am extremely excited to be offering this service to our patients. Diva is the first hybrid fractional laser for gynecological and genitourinary health here at Blush Aesthetics. This means that you're going to get 2 separate lasers treating multiple layers of the tissue in one simple, quick, and effective treatment. Next slide. Why Diva? Diva is a patient-specific based on age, health-related concern, symptoms, as well as individual desired outcomes. We chose Diva to help treat things like vaginal laxity, loss of sensation, women who are experiencing painful intercourse, bladder leakage, urinary incontinence, thinning and drying of those vaginal walls, as well as vaginal scarring post-childbirth. Next slide. It is a quick treatment, less than about 6 minutes. It's extremely precise. It is tunable by one of your providers for both the ablative and non-ablative lasers, which mean that we're going to be able to treat those various layers of the vaginal wall. It uses high precision automation, which is called HPA. It is a very uniform, safe, and effective treatment every single time. Next slide. So let's talk a little bit about vaginal health. We're looking at this first picture here on the left. If you go to number 1, we're looking at the epithelium and the lamina propria. These are typically non-keratinized cells. It's very similar to the lining of the inside of our mouth. It has many folds in the tissue with a rich vascular supply. Number 2, at the bottom of that first image, that's the smooth muscle of the vaginal walls. That second picture there in the middle, that is representing that first perimenopausal thick epithelial walls that are filled with glycogen, very rich blood supply. And that last picture there, you're looking at a replication of a postmenopausal vaginal wall where the epithelium becomes really thin, it starts to dry out, and it loses a lot of that glycogen storing. Go ahead and go to the next slide. So why does this happen to us? First and foremost, we are losing estrogen production. As we mature, that reduction in the amount of production from estrogen from the ovaries significantly decreases. For patients who have had hysterectomies, you've breastfed, you've had to undergo chemotherapy treatments, estrogen production is also affected. Childbirth really stretches that vaginal canal and that supporting tissue. The vagina may not actually return to the same state before birth. So stretching of that supportive tissue damages even further the vaginal walls and the perineum, which can create less support for those surrounding organs, such as of those in the urinary tract. What can you expect with your Diva experience? This is actually one of my favorite treatments to perform. You're going to be in the very caring hands of one of our board certified nurse practitioners whose passion is really patient safety and satisfaction. These treatments are customized to you. Your Diva uses a sterile single-use handpiece attachment. Other devices on the market have to be autoclaved because you use multiple, pieces on different patients. Devices that use radio frequency are typically less effective and more superficial. Electrical stimulation treatments can typically take up to 30 minutes or more, and you may need 6 to 8 treatments and many more treatments after that for maintenance. Diva really only takes about 6 minutes or less. We do 3 sessions spaced about 4 weeks in between those. And then if you want to do a yearly maintenance treatment, you may. And then fractional CO2 devices, which are also pretty popular, are not customizable and they're not as precise because they're so much more superficial. What can your Diva experience look like? You'll come into the office, we'll do your treatment. It's only going to last about 5 to 6 minutes. After your treatment, you may have a feeling of fullness in that vaginal cavity. Mild bleeding for 12 to 24 hours is pretty common and extremely normal. Mild cramping is also normal. It's kind of similar to period cramps. You can use Tylenol to help with that. We ask that patients hold off on any type of vaginal penetration, use of douches or tampons for about 48 hours as those walls heal. And then, we also offer Pronux in the office, which is laughing gas for the people out there who are nervous Nellies like me about these kind of things, that to help keep those patients very comfortable, enjoy your treatment. And then you will have access to your blush provider post-treatment for any and all questions. We're here to help take care of you. So yeah, that's Diva. If you guys have any questions, I'm super happy and super excited to be able to answer them. So just let me know. Thank you.
Thank you so much, Charlotte. That was wonderful. So you can kind of see how some of these hormone-related issues that we're having kind of overlap one or over the other. And so as you're kind of decreasing in estrogen, you're decreasing in progesterone, we have symptoms, physical symptoms that can affect our relationships and that can affect our satisfaction with life. And so a lot of what we bring on, I always say we're trying to bring things on that improve quality of life. So one of the first things that we think about whenever we're bringing on new technology is how is this going to improve the life of our patients? And so that's one of our kind of main pillars that we work from here. So one of the other treatments that we have brought on also is the treatment of lichen sclerosis. So as I mentioned earlier, my name is Erin and I'm a nurse practitioner here at Blush. I went to Case Western Reserve University in Cleveland for my bachelor's, my master's, and my doctorate. So loved it there and stayed for everything. And I've worked, actually, my background was in burn trauma and reconstructive surgery, mainly in pediatrics. So I dealt with a lot of burn patients, and that's really where I got introduced to laser. Now we're using it in so many different ways. And one of those ways is for lichen sclerosis. So lichen was something that back when we were in school was presented as something that was rare. And what we're learning a lot more is it's not rare, it's just misdiagnosed, or it's a diagnosis that goes without saying because there wasn't really much that anybody could do about it. And so as we have met more and more of these patients that say, I was going to my OB, they thought that I maybe had a fungal infection or a yeast infection. I got treated for it and my symptoms didn't improve. I have itching, I have discomfort, the skin is getting tight, it's getting a little bit more shiny. And so I'm having these skin changes and I'm also having these terrible issues. A lot of times how this is diagnosed is by a biopsy, by your OB/GYN. Sometimes it's diagnosed just by visual examination as well. And so we have patients that come to us that were diagnosed by visual exam and that were also diagnosed by biopsy. It does not matter how you come to us. We are happy to have you because we're happy to help you. In the past, the only therapy that we really had for lichen was steroid cream, and it didn't work great. And so, they'll say, well, we have some treatments that can help it, but we don't have a cure. And that's true. We don't have a cure. But what I can tell you is that the patients that we have treated for lichen come back reporting after their first treatment, improvement of 90% and greater of their symptoms. And their skin looks healthier and it is acting healthier. And so where I know it's not a cure, it definitely helps significantly. And so when you go from kind of being miserable every day, from those nerve endings being on edge, from having that skin that just doesn't want to be flexible like it should be, sometimes it also comes with painful intercourse, sometimes it comes with painful urination. There's something now that we can do about that, something more than just steroid cream that was really largely ineffective. So this is, kind of one of the most common, I would say, superficial disease processes that we see in the skin now, especially now that we are, kind of offering some of these laser therapies. And so this is, again, often mistaken for a chronic yeast infection that doesn't improve with traditional treatments. So if that is speaking to you, if you're like, yes, this is what I've been dealing with, I keep telling them it's not getting better, I've been on the medication, nothing improves, definitely at your next OBGYN appointment, which really should be yearly with either your women's health NP or PA or OBGYN, definitely bring up, could this be lichen? And because there are so many providers, even those very experienced, that have been told that this is a rare disease that, aren't really looking for it maybe, that can be, kind of help moving in the right direction. So again, steroids can be applied to the skin for that. Emma, if you can go one back just for a second. Patients are often told that those steroids are the only treatment, but I am here to tell you that it's not. So we have had great success with this. And if we can help patients, again, live a better life, live a better quality of life with this disease process, we want to do that. How long do results last? That's the first question that we get. And what I'll say is that we have a patient who was treated 7 years ago in one of the studies that I got to be a part of, and she is still having great luck with it today. So she has had 1 or 2 touch-up treatments of new areas of disease process that have popped up, but largely is very happy with her results. And so we've had folks who are out a year, out 2 years, out 3 years, very happy with their results, maybe needing just a touch-up of, again, newer areas. You can move on to the next slide. So we use a topical numbing agent. Why? Because I'm wimpy. That's the bottom line. I'm wimpy. And so I just assume everybody else is wimpy too. And we're dealing with a very delicate area that has a lot of nerve endings. And so we use numbing agent. If you also would like something like Pronox, we can use that as well. We can do oral therapies for anxiety if that is something that you need as well. So we are able to have a couple different things up our sleeve that we can use to make this a very comfortable treatment for you. Total treatment time, depending on the disease process that we're seeing on the surface of the skin, could be 30 seconds to 2 minutes. So again, a very quick treatment, just like Diva. Diva, anything that you're in stirrups for, ladies, I'm sorry, the quicker it can go by, the better off you are, right? So any of these things that we have to be in stirrups for, we have found a way to make very quick. And a lot of that is just the excellent training that we have as nurse practitioners in doing these treatments and all of the women that we have seen and helped with them. So the healing process is simple and it's easy. When you leave here, you may have a liner in just in case you have any pinpoint bleeding. And over the next couple days, it's simply cleaning the area with Dial antibacterial soap and applying a barrier balm like Aquaphor to the area. A lot of times people will say, I did have a little bit of peeling of that area as the new healthy skin was coming through, but that's not uncomfortable at all. So there's a little bit of heat, almost feels like a sunburn for about a half hour after the treatment, and then no discomfort from there. A little bit of swelling, but nothing that is going to prohibit normal everyday function. We do follow up in 8 weeks because we want to see you back. All right, so our next segment is going to be on weight loss. And this is probably one of those popular things that we get questions about, that we get phone calls about. I feel like we see semaglutide everywhere, Ozempic, Mounjaro, all of the medications that are being used to combat some of these weight issues that we have. We're learning so much more about weight loss and so much more about these medications and how safe and effective they are. And I can't wait for you to hear from Bella. So Bella, take it away.
Hi, everyone. Thanks, Erin. So my name is Bella. I'm one of the NPs here at Blush. So I'm just going to talk to you guys about weight loss. Next slide, please. So what is it? So they are really medications. They fall under this kind of big umbrella GLP-1 medication. So you ask yourself, what is a GLP-1? So they're what we call glucagon-like peptide receptor agonists. So in short, it's a hormone and it's released in the gut. So when you eat certain foods, it actually tells your pancreas, you know what, hey, we're going to release some more insulin, maybe a little bit of insulin, depending on what exactly you ate. For this reason, these meds have been great for glucose control in our type 2 diabetics for decades and decades. And they've noticed over the past handful of years that when we increase the dose and someone's given a higher dose of these GLP-1 medications, they're actually, interacting with a part of the brain that suppresses appetite, making you feel fuller for longer. And they've noticed that, because of that, people have been losing significant amounts of weight, especially when in combination with diet and exercise. So these are medications that they are not oral, they can be, but they just don't work nearly as well. The ones that we do, they're going to be injectables once weekly. And similarly to what Aaron had said, Ozempic and Wegovy, Mounjaro, those are all brand names of the medications. So Ozempic and Wegovy in its generic form is semaglutide, and then Mounjaro in its generic form is tirzepatide. And yeah, Emma, next slide. Thank you. So benefits of these medications, kind of I've touched on a little bit, suppressing that appetite. It's going to make you stay fuller for longer. And this can really be attributed to slowing that digestive system down. That entire GI tract is slowed down. Again, helps reduce blood pressure, cardiovascular, heart disease, heart attacks, strokes, diabetes, cancers. It's a huge list of things. And it can also aid in the prevention of high blood pressure, diabetes, elevated cholesterol. Possible side effects. I'm not going to go through all of these here on the slide that you're seeing. Some of the common ones that I see, actually very common, are going to be that nausea and constipation. And there's a lot of ways to combat those two side effects. And if and when this is right for you, we'll discuss that more in depth in our consults. Some other, oddball side effects, I guess you could call them, is going to be fatigue and possibly even a headache, or a worsening of headaches or frequency of headaches, especially in that first month. And really, that's just your body kind of getting used to that medication. And they tend to usually subside the longer that you're on the medication. So you might ask this question, are these types of medications right for me? Is this going to work for me? I have stubborn weight that I just cannot get off. If you kind of look at that yes column, you see that if your BMI falls under that overweight or obese BMI reading, this could be right for you. A lot of the weight-related health problems, like we've said, the elevated cholesterol, elevated blood pressure, type 2 diabetes, things along that line, that's a discussion that we can have, and it might be the right medication for you. Usually these are not good options for people with history of pancreatitis, gallbladder disease, multiple endocrine neoplasia syndrome type 2, and then medullary thyroid cancer. And then how is it prepared? We use two compounding pharmacies. And the difference is that one of them here, some of you might be familiar with Buder Pharmacy in Perrysburg. They just come in pre-filled syringes, whereas University Pharmacy comes in a vial, and we'll discuss, more in-depth specifics and differences, in our one-on-one consults. And then how to administer, it's very simple. We say we want to give this medication and inject it in an area on our body with higher areas of subcutaneous fat. So for most of us people, that's going to be our bellies, under the arms, areas like that. So I usually tell my patients, stick to belly. It's easier to see, especially if you are self-injecting. And I usually instruct them to rotate the sites every week. It's really just, if you keep injecting in the same site, you might see some pinpoint bruising, some pinpoint tenderness, nothing too severe, but just an easy way to avoid that is rotating sites every week. And then really that's it. So if you're looking to get started at Blush, you just book an initial consult. We'll have a more in-depth conversation, kind of diving deep into your medical history and the medications itself that I think might be right for you. And then, we'll meet for weekly check-ins and see how you're doing. Thanks for listening, guys.
Thank you so much, Bella. So we have 2 locations, and our weight loss appointments and our hormone appointments actually are going to be by telehealth. So you can do those from the comfort of your own home. You can do them on your lunch hour. We have folks that do them from their car. So we are very available to you at various times for any of the weight loss or hormone consultations. We're happy to see you for those. If you feel like you might be a candidate for our lichen sclerosis or Diva treatments, we would want to see you in office, and just make sure that you have all of the information that you need for the procedure, and that we are kind of answering all your questions and getting you set up for that in-office procedure. So thank you everyone for watching this webinar. We will go ahead and email you with your special offer that we're going to have for anybody that attended. So if you are going to look in your email just this evening, you can go ahead and check it, and we'll have a special offer with a percentage off of your consultation. So thank you everyone for attending. And again, please feel free to reach out. We are available by blushnwo.com, our website. We're available by phone, and we're also available by text message. Have a wonderful evening, everyone. Thank you so much for spending time with us.